When it comes to losing weight, it's a billion-dollar industry with thousands of products. The use of peptides or GLP-1s is getting amazing results, but our next guest warns it's not a one-size-fits-all plan. Whether you're aiming to shed a few pounds or lose a significant amount of weight and address wrinkles and sagging skin left behind, Dr. Rolando Morales, his patient Rachel Phelan, and weight loss patient coordinator Ashley Mendoza are here to share the importance of medical supervision and the comprehensive program at the ACPS MedSpa that gets results. Good morning.
Good morning.
All right, Dr. Morales, I'm going to start with you. You're known as the Fit Doc because fitness and health is just a part of your everyday life.
I live and breathe it every day. I've always worked out all my life and then got into the sport of bodybuilding. My wife and I did, and we turned professional in 2019, and that just really kind of endorsed the fitness lifestyle. You know, really started really changing my food relationships and alcohol, and just kind of, and then carrying that into my practice.
Yeah, because into your practice is how we deal with food. You know, obesity is at pandemic levels in our country, and we're seeing it in kids, and it results in, you know, things like type 2 diabetes, and it keeps going. And so GLP-1s have been kind of a game changer for a lot of people. Explain what they are.
So these are new peptides that came out that they're not, you know, new, and they've been in the weight loss industry, specifically for diabetes. It's been a medication for diabetes. But then, you know, you saw the celebrities get on and they lose all these weight, right? And then the next thing you know, they're just like 100 pounds less. And so these peptides, how they work is they're hitting receptors within the intestinal tract, also in the CNS actually, and in your liver and everything like that. And they help change your relationship with food. You tend to have less cravings, you actually eat less, and that's kind of the magic ingredient of how these works. The first one you've heard about is called Ozempic, and then now there's a second generation GLP product called tirzepatide, and that's like the compounded brand. But this medication is even more effective, so we found the second generation is much more effective than the previous generation with the semaglutide, also known as Ozempic.
All right, well, here's the thing. That's that magic pill we've been all looking for, the magic shot, the magic pill, and when that happens, it's like people jump on it. Here's the problem. You're talking about your body. You're talking about your health. And, you know, I question, like, when people are getting things through the mail, or it's like they call their friend, hey, do you have any extra shots left over? It's like there's such an advantage to being medically supervised.
I can't emphasize that enough. You know, these peptides are now being offered on the internet, and you have no idea, would have any relationship with a medical professional. They're just prescribing it left and right. Where you're getting this compound, the compounded version, and you have no idea what kind of pharmacy is producing it. You don't know the quality, the safety of it could be contaminated. I mean, there's so many factors associated to it. So if your patients are considering this peptide, you really need to find a medical professional that understands it, has experience with it, and also can help you other resources with accountability, such as nutrition coaching, as well as exercise if possible.
Also understanding why you want to lose the weight. There are some people, I mentioned the obesity levels, that really need to lose a lot of weight for health reasons specifically. Some people it's more about aesthetics, and Rachel was like getting your body back after what your kids did to you.
Yes, so 2 kids and 20 pounds over, so I definitely wanted to get back to my pre-baby weight, and I want to do a mommy makeover towards the end of this year. So the biggest thing is getting to your goal weight before actually having plastic surgery.
And Dr. Morales, that's so important because sometimes people look at things like a tummy tuck or liposuction and they go, oh, that's my weight loss method. It's not a weight loss method, that's the contouring method,
that's
right?
Exactly right.
But first you want to get patients for the body to kind of settle where it's going to be. That way you better know what to address.
That's correct. You know, patients considering, you know, cosmetic surgery for body contouring should really focus on finding your ideal body weight. You need to find a nice balance in life, in both your personal life, your family life, and work life, and how you can, you know, manage your nutrition and what you're eating every day, as well as exercise.
Yeah, and I mentioned being a comprehensive program. So Ashley, you are the patient coordinator. We know so many times that you want to pick up the phone and call the doctor, and they might not be available, but the patient coordinator, that becomes your best friend, right, Rachel?
Yes.
Yeah. What are some of the things that you do, Ashley?
So I guide the patients through the whole process. We do have some requirements before they can receive the medication, so I get all of that prepared for them, set up their consultation with Dr. Morales every month, check in with them. We do their KHOU body scan. So we measure their body fat percentage, muscle mass, lean mass. We want to make sure while they're on this medication, they're only losing body fat. We don't want them to lose any muscle.
Yeah.
We're strictly wanting to target the body fat. I offer them the resources we have, nutritionist, trainer, check in with them. If they have any side effects, we can really catch them soon and alleviate them as soon as possible.
And all that stuff she just said, you don't get through the mail. Again, if you're dealing with somebody through the mail that is miles away who doesn't know what your situation is. Another thing that's so important is that you ask for patients to get labs, because you want to know where someone is. If you have diabetes, it'd be a good idea to know that, right?
Absolutely. It's really, the idea is you want to make sure we have an understanding of your baseline physiology. So we test your enzymes of your liver, your kidneys, your blood work. I actually require an ultrasound of your thyroid. One of there is an associated cancer associated to the thyroid, and some people don't even know they have issues with this, but it's a rare side effect that can promote with the peptides. So I want to make sure we're all good there. So we do an ultrasound. It doesn't hurt. And we have a baseline assessment of your thyroid. We get your thyroid hormones as well to make sure you don't have any issues with your thyroid hormone itself, which does cause weight gain.
Yeah. It makes it almost impossible to lose weight unless you address that, right? Another thing she mentioned about checking in all the time. There are some people who this has not been successful for, but there are reasons for that. I know one person, she goes, I can't, it makes me too sick. Right. Well, you can address that. Again, having that supervision, you can do things like titrate it.
It's so important to have accountability and someone who's actually watching you. That's the secret to the success of the peptides, because the peptide is a transition medication. It's not a lifelong medication. I want to emphasize with patients considering this. You should not plan on being this peptide for life. Yeah. The idea is it helps you get the ball started, and then you change how you eat, your relationship with food, you start exercising, and next thing you know, you've lost 50, 60 pounds. Yeah. And then you're feeling better, you're exercising more, you don't wear the same clothes anymore.
If you had diabetes, some of those things can be,
and that's what's special, is that we're getting patients off of hypertensive medications, cholesterol medications, hormone medications, and it has changed your life in a long-term effect. Yeah. Does that make sense?
If someone's, absolutely. If someone says, well, I tried it and it stopped working for me, they may have plateaued. Once again, you can mitigate that.
That is correct. We're able to monitor the symptoms. We're also to make sure we're getting an effective dose. And then the idea is that we have someone accountable that they're going to be accountable to, right? We're checking in on them. We're doing their body scans on them like the basis. We're checking their hormones and labs every 6 months.
Yeah, all right. Now, Ashley, when people start losing weight, sometimes it shows up in the face, but you can help people keep up with things, right?
Yes, we do offer different treatments in our med spa. We have Botox, injectables, facial treatments, other non-invasive treatments, and we can definitely help get you looking your best.
Yeah. And Rachel, when I saw, I thought, oh my God, your body looks fantastic. But so you dealt with the frustration before. You tried everything to lose the weight, and it was just difficult to do. It just wouldn't budge. But using this helped you get there, and now you're hoping to go that next step. Because I want to point out, you are, again, if I didn't say that earlier, are also a plastic surgeon. You can take care of all kinds of things, head to toe.
Yeah, happy to help.
Yeah.
Yeah. Some of the changes associated with weight loss, without the peptide. The changes of the body, we tend to get loose. We have a more looser elasticity of our skin, stretch marks, and that's not going to go away at diet and exercise. Yeah. It tends to get a little more looser skin. So we have body contouring surgeries that we can do to restore and rejuvenate, like the abdomen or the breasts or the arms or thighs. We have non-surgical treatments as well in the spa that can do some skin tightening as well. So there's a lot of things that that patients who've lost a lot of weight should be prepared to maybe kind of start looking at, and that's where we can come in.
I could walk in Deborah Duncan and walk out Beyonce. Okay. And what would you say to somebody who's been putting it off and has been frustrated?
I think you should pick up the phone and call Ashley to set up your consultation, because it has definitely been life-changing. I honestly wouldn't have been able to get to where I got to without the help of Ashley, Dr. Morales, and Terzepatide.
All right. Boost your confidence. If you're ready to take charge of your health, balance your weight, and get the body you want, schedule a consultation today. ACPS MedSpa is currently offering a special promotion. Now through the end of October, receive $150 off each tier. Those tiers are if you just use the GLP-1, or if you put a nutritionist with it as well, and then weight training as well to tone up those muscles. Give Dr. Morales a call at 713-799-9999. Again, that number is 713-799-9999. Why does that number sound familiar to me? All right. Or visit their website at acpsmedspa.com. Financing is also available with Patient Fi as low as $188 a month for their weight loss program. Thank you all very much.